the Maria Holder Diabetes Center.
Even without symptoms, uncontrolled blood pressure can damage your organs.
If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money. But members get 10% off.
It's time for 15 minutes on 100.7 QFM. Compliments the Barbados Diabetes Foundation, the Barbados Diabetic Eye Screening Program, and the Maria Holder Diabetes Center. Good afternoon, Q family. How you? This is Peter Boyce here, and it's not just 15 minutes that you'll be hearing next, but 15 diabetic-friendly minutes telling you all about the Maria Holder Diabetes Center located in Warren, St. Michael. But you might be saying to yourself,
I know about them already.
But do you know about the vascular screening program that they have? Where if you have problems with your feet swelling up, or if you feel you might have vascular issues, what Bajans usually refer to as bad circulation, that you can go and get a vascular screening at a reasonable cost?
Wait, why do I know that?
Yes, and you can also get a vascular printout so you can have it for your records and also to take to your doctor for an assessment.
I didn't know that either.
So you just feel you know everything, but you don't know? Let's hear what vascular spokesman Donald had to say about getting a vascular screening.
Once you have reached 50, you need to go and get that check done. It's peripheral artery disease. It's a simple test. It's called an ABI test. What they're looking for is to see the blood flow in your lower extremities. And I can't stress enough the importance of getting this test done. I'm glad to know that the Maria Holder Foundation is offering this. Individuals need to go and get that test done. It's a simple test. It's all external. Again, it's like taking your blood pressure on your lower extremities.
It is simple and painless. You hear that, peoples? Because I know there got some people out there that's be fighting for them skin. But you know what else is also simple and painless? Getting your eyes screened for diabetic retinopathy. Once you are diabetic, you need to be doing that once a year.
You mean every single year you're supposed to be doing that?
Yes! Not once in a blue moon or a red moon or when you feel like it, but once every single year. Let's not go blind in 2025. If you have not done it so far for the year, call and make an appointment. Get something to write down this number. You ready?
243-3937.
Yeah, Alfonso here. I take a pause from picking up my clothes for you in the community tomorrow to come and introduce my friend, Dr. Diabetic. I just call she Dr. D. And you know Dr. D does always have some interesting health topics to discuss by Q. Last week, the doctor talked about cardiovascular risk and high blood pressure. And you know that's something that we gotta be real careful with in Barbados and the Caribbean. Cause that's why it is that we gotta cut up on all the soil that we be using. Anyways, what Dr. Bradford gonna be talking about today is hypertension, heart disease. So try and stop what you're doing and pay attention to this. It's important. This is Dr. D.
So with hypertensive heart disease, basically what that means is that the blood pressure is high, the heart muscle is squeezing and working harder over a period of time to pump the blood around the body against this high pressure. And what happens, I'm going to break it down into stages for you. Try not to get too complex, but I like to share facts. So a muscle that's squeezing hard and working hard is going to get thicker. But what happens to the heart muscle? So you get some thickening of the heart muscle, and so therefore you can get some what we call left ventricular hypertrophy or enlargement in the muscle on the left side of the heart, the lower chamber, that squeezes it to the rest of the body. And that's probably one of the earlier things that we see. And when the muscle is thick, the muscle isn't able to relax properly. And how the heart works, the muscle has to be able to squeeze properly but then relax so the heart can fill up with blood. Okay, so you may get impaired relaxation relaxation of the heart muscle, all right? And then as the heart muscle works harder and harder over time, what happens is the heart muscle is like, I'm done with this. And the heart then decides, actually, I can't squeeze as much blood. And that's when you move into the phase where you start to have what we call heart failure with kind of reduced pushing of the blood or reduced ejection fraction. So those are the main two types: heart failure with what we call preserved heart squeezing or preserved ejection fraction, and heart failure reduced ejection fraction. I'm not going to get more complex because that's already complex. And so what happens, it's like a plumbing system. If your heart's not squeezing properly, what happens is you get fluid backing up behind the heart, which means you might get more fluid in the vessels of the lungs. The fluid in the vessels in the lungs can then seep out into where the air should be, and you can get problems with breathing. So you might get a little bit of what we call pulmonary edema. Pulmonary edema just means water in the lung tissue where the air is supposed to be. You might also see with this backing up process, you may get more congestion of blood in the liver because it's not moving through quickly enough, and you can get enlargement of the liver. You can get swelling of the legs. So these are the common things really that you think about. If high blood pressure is affecting your heart, you think, am I getting more tired? Am I getting more short of breath? Am I experiencing swelling, in the body? High blood pressure does injure and damage the eyes. It increases the risk of stroke, obviously. And of course, it is the leading cause of kidney damage, followed very closely and often rivaling diabetes as the number one cause of kidney damage. So your blood pressure is not to be ignored. You should have controlled blood pressure, all of us at all ages. And please invest in a home blood pressure machine for the family, or it can be even, a slightly more remote space, but or have a source or have some way of checking your blood pressure. If you have any issues with high blood pressure or diabetes, and especially if you have diabetes and you're living with blood pressure that's difficult to control, please reach out to your healthcare provider. It is imperative that your blood pressure remain controlled. So go out there, take care of yourself, have fun, but remember, you have to take care of your health. This is the one body that you do have that's going to take you throughout this lifetime. Take good care of yourselves, and thanks for joining me, and thanks for joining the Diabetes Center. And I can't forget Alfonso, because if I forget Alfonso, I'm in trouble. Bye-bye.
Dr. D, I let you know, because I was ready to hear my name. You don't like to hear my name bad. Anyways, I enjoyed your presentation muchly, and I know the Q family listening enjoy it muchly too, and they would have learned something, because that was some good, healthy information. And people out there listening, do not let all this information that's going on here come out the next. Try and look to put this advice into practice so that you can end up living a good, healthy life. All compliments, the Maria Holder Diabetes Center. I gone.
Sugary drinks spike your blood sugar faster than anything else. Water is your best friend.
The Maria Holder Diabetes Center.
September is back to school time, and you might be wondering, if your child is diabetic, how would they be managed in the school system? For more information on this, we go to diabetes specialist pediatrician Dr. Michelle Lashley.
We think that education is probably one of the biggest things that we can help schools with, either through their social workers, their guidance counselors, or otherwise, or even in sometimes what the physicians or the caregivers will be encouraged to do will be to have sessions with maybe the parent-teacher associations, so that both staff as well as other parents will be aware of how these children who have a chronic illness will be managed throughout the school day. The school staff should be aware of the symptoms, as I said, of low blood sugars and how this should be managed. And even with older children who are independent and managing their care, they may still need some supervision of their mealtime and activities, because some, particularly an abnormal blood sugar, either very high or very low, will affect the child's ability to think clearly and to manage their condition appropriately. So the teachers really should be aware of what some of these symptoms look like, what kind of things they could be looking for in the school day. We also have to consider that the student has a right to full inclusion despite their diabetes, especially the adolescents. These older children and youth don't want to be singled out in a way that might make them feel embarrassed or have a stigma to make them look different, but they still want to participate in all activities that their peers may be doing. And the school should encourage this, giving these children and youth that safe space where they can manage their care, and the schools may then have to allow these children to have the use of maybe the sick bay, if there's one in the school, a school office area where they can manage their blood taking or managing their insulin administration, and even a counselor's office if needed, so that they can go without looking as if that they are slightly different or doing something different than the other peers. Unfortunately, because of the continual health care that's needed for any chronic illness, some students may have to attend regular health visits. And the other thing the school can do to help support these children is to make sure that they are allowed out during the school day if needed for their healthcare visit, and the school attendance policy should not penalize students if they have to have regular appointments when their diabetes care maybe need a little bit more intensive management. So in order for schools to participate in these kind of activities and support, as I said, the staff need to be educated a little bit about diabetes. And sometimes there are myths that our general population may have related to diabetes in schools. And I just wanted to mention a few points that might be helpful for when teachers are thinking about they have a new child who may have diabetes in their school, what actually happens to them.
We go from Dr. Misha Lashley talking about diabetes in schools to a calypso about school. As our Q song of the day, this is the Mighty Sparrow with School Days. Compliments, the Maria Holder Diabetes Center.
Holder Diabetes Center.
In days of old, when men were poor and paper was not yet invented, men used to wipe their glass with razor grass and walk away quite contented. A riddle, I see two old men be. They be so fast and they make me laugh. A riddle, run down quick, little boy, run down quick. The donkey trip and your sister stay. So little boy, run down quick. A breeze between two mountains pain. Plenty pain. Water lay down and water stand up cane. It's sweet, sweet cane. Them was happy days, really happy days. School days was happy, happy days.
For a long time I was prolonging not to have my eyes, I went to get an eye screening. I checked for a long time, but because of I had a cataract operation 5 years ago at the hospital, and then when I would go to the hospital, because of the amount of people that goes to the clinic there, you don't always get special attention. And just about a couple months ago, Diabetes Foundation, they had called me, Dr. Prophet, send the message that they were doing the eye screening program, and I went and I had my eyes done. Both me and my fiance, and I can say that I was well satisfied with the result. Right now the cataract is under control, so I would say yes, that is very good. It's very good for diabetic.
If you are diabetic or pre-diabetic and listening to QFM right now, in 2025, Q stands for Quality Health Services at lower prices, which is what you will find at the Maria Holder Diabetes Center located in Warren, St. Michael. If you are looking for diabetic eye screening, vascular screening, podiatry, or nutritional advice, call 243-3937 or 417-0305 and make an appointment today. Don't miss next week when we will be dealing with more diabetic issues. Same Q time, same Q station. Compliments, the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the Barbados Community Foundation.
If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier order to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
But it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
Eye exams, kidney checks, foot exams. These are all part of whole person diabetes care.
The Maria Holder Diabetes Center.